Good morning. I'd like to go ahead and get started. So as chair of this consensus study and of this public session, I would like to welcome everyone, including those of you participating through the webcast. The task being undertaken by this committee for the Institute of Medicine, National Research Council, is to conduct a study that will produce a comprehensive report on the state of the science on the biological and psychosocial consequences of peer victimization and bullying, and the risk and protective factors that either increase or decrease bullying behavior and consequences. You can find a committee roster and biographies in your meeting materials, which have also been posted on the project website for those of you on the webcast. I want to give you a sense of the format of today's meeting. There will be 4 panels in which speakers will provide prepared presentations. Committee members will have the opportunity to ask questions of the panelists following the presentations, and then the floor will be open for questions from the audience. At the end of the day, we will also have an open discussion period during which time the audience may ask questions. Web viewers may submit questions online, and a staff spokesman will read your question. In addition, I want to note this is an open, on-the-record session. Interested individuals have been invited to attend as observers. Reporters who would like to talk with members of the committee are kindly asked to touch base with the study director, Suzanne Lebin-Strel, and should plan to do so during a break. If there is something you want to be sure is brought to the attention of the committee for their consideration, written input and suggested resources are welcome anytime during the course of the study. Please email the address on the screen. That's Danny's address. So not that address. Email Suzanne.
Yeah, email me, yeah.
I also would like to remind everyone this is an information gathering session. That is, the committee is in the process of assembling materials to examine and discuss in the course of making its findings, conclusions, or recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions, and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the Institute of Medicine or National Research Council. In addition, committee members typically ask probing questions in these information gathering sessions, which may not be indicative of their personal views. It's like the Supreme Court. The committee would deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee. The committee then must respond to this review with appropriate revisions that adequately satisfy the Academies Report Review Committee and the chair of the NRC before it is considered NRC report. The committee's report is expected in the spring of 2016. So we'll go ahead and get started then. The format here for the first panel is we have 2 speakers. We're going to devote 30 minutes to the first speaker, 15 minutes to the next speaker, and then we'll have 30 minutes for questions afterwards. So each discussant will be given the opportunity to respond to moderated questions in the conventional conversational dialogue. So our first speaker is Danny Pine, who is the Chief Section on Development and Effective Neuroscience of NIMH. Dr. Pine is currently chief of the section. Over his career, he has been engaged continuously in research on pediatric mental disorders. His group at NIH is currently examining the degree to which pediatric mood and anxiety disorders are associated with perturbed neural circuitry functions. He will present on the neurobiological effects of bullying with regards to the child who is bullied, the child who bullies, and the bystander. Dr. Pine.
Thank you.